So let's talk about how we're going to make money off the less fortunate. Lots of student journalists around here just writing articles while they wait for the talk to start. Wait, what?
There's Jared and Jacob. No, they're in
Jared, where's the secret hide? Is Jared in HVAC?
I don't know, is he?
Jared, are you in HVAC? What's the secret hideout?
Those of you who are still, being playing around, could go ahead and find your seats. That'd be great. My name is Connor Roberts, and I'm the president of finance of HVAC. And so before we begin tonight, I'd like to read a statement provided to us by the Dean's Office about free speech. So we'd like to remind everyone that this event is in accordance with the university's stance on free speech. This gathering will be governed by FAS guidelines on free speech and expectation of respectful dialogue. The speaker will speak and may not be interrupted. There will be a time for questions. Questions were collected at the beginning of the program, and depending on time, the moderator will pose a select number of questions to the speaker. If there are disruptions to the event, those disrupting the event will be asked to refrain from disruptions by university officials. If they do not, they will be asked to leave also by university officials. If they do not comply, they will be escorted from the event. And so one quick clarification, so those of you who have signs, you're welcome to stand at the back of the room and hold the signs, but just make sure you're not blocking anyone's view for the purpose of, make sure everyone can see the event and that sort of thing. And so I see some phones out already, so I just want to add this really quickly. There's no photography or recordings of the event will be allowed. And again, people not complying with previously stated rules will be escorted from the event. And so now one of our members of the Harvard Financial Analyst Club, Doc Who, will introduce Martin Shkreli.
Thanks for making it out tonight. The Harvard Financial Analyst Club is excited to host Martin Shkreli for a talk about investing and the pharmaceutical industry. Mr. Shkreli is an investor, an entrepreneur, and a pharmaceutical executive.
And a murderer.
He has founded 2 hedge funds, Elite Capital Management and MSMB Capital Management. He's also founded 2 biotech firms, Retropin and Turing Pharmaceuticals. We look forward to hearing Mr. Shkreli speak, and we hope you guys enjoy. Thank you.
Shocked at what you hear.
Sorry, pedophile. Nope.
Pedophile?
Yeah.
maybe you know something I don't. We can talk about that after. I just want to make sure I have a slide clicker somehow. Thank you. Like I said, I just gave a speech to Austin. I probably went in there with half the people probably want to tear me to shreds. And I think I walked out with a lot of new friends. So give it a shot, give me a fair shake. You can be as hard as you want on me afterwards. All right.
Can we duo with me?
What?
Can we duo with me?
Yes, we may do over.
What did he say?
All right. So I'm going to spend some time talking about my life. I think a lot of people don't know much about me. And this is a street I grew up in Brooklyn. 33 years old. I come from an Albanian immigrant family. My parents were janitors. One is still a janitor. My mom won't quit. So we made a deal that if I get married, she'll quit her job finally. But growing up in, I don't know if I'd call it the hood or not, but
No, you wouldn't.
I've had guns pointed at me in this neighborhood, so it's up to you if you want to call it the hood or not. But,
modest wage cleaning buildings like this for people like you. So please show some support. Anyway, I remember playing basketball here, so talk about the hood. I remember playing basketball, I was this tall.
What the fuck? That's like so racist. What are you doing? Like, why
What do you
are
mean?
talking like that?
What do you mean?
Fuck you, murderer, and fuck all of you who support him.
All right. Maybe I won't tell the hood story, but I do come from the inner city.
Racist.
I do come from the inner city. I don't know why that's racist. I'm perplexed. Anyway, I just want to talk a little bit more about my life. So growing up, and this isn't going to be that fun, by the way. This is a technical, dry discussion. It's pretty nerdy. So if you enjoy it, great. But I don't promise anything. So with respect to my life, this is a good collage of kind of me from 8 years old to 18 years old. I love programming. A lot of people don't know that, and I now program again. So I took a bunch of time off to work in the hedge fund industry and start drug companies, but for a long time I thought of myself as a computer programmer, and I programmed in BASIC, beginner's all-purpose symbolic instruction code that Bill Gates, Harvard alum, helped pioneer. And I eventually got into finance, so this is the oldest Yahoo Finance screenshot I could find from 2002, but I would stay up all night, reading and learning about stocks. I kind of got bit by that bug. And I always loved music, and we'll talk a little bit about music tonight. I always loved the future. I think Ray Kurzweil is kind of an idiot now, but at the time I was enamored by Ray and his future prognostications about when machines would become sentient and things like that. I went to a high school called Hunter High School, which sends a lot of please, which sends a lot of kids to Hunter to Harvard, and I ended up giving Harvard Hunter the biggest donation they've ever received. Just a few years ago. I think most people wait for philanthropy till they get a lot older, but I thought it was important to send a statement that where you go to high school matters sometimes as much as where you go to college. So anyway, I certainly was taken aback by math as well. I ended up working for Jim Cramer and his hedge fund. He's another Harvard grad. When I was 16, so I started there on March 1st, 2000, and I turned 17 shortly thereafter. I think my job was mostly getting water for Jim and being fodder for him to curse at me and things like that. But eventually, it was the year the human genome was decoded, so to speak. That's a misnomer, scientifically at least, but that was the year Craig Venter and the government decoded the human genome. And I ended up working for a so-called Tiger Cub from the Julian Robertson School of Hedge Funds. So those were my first two jobs. And what I'm going to do here is I'm going to go through probably about 4 or 5 different investments I made. How many people are here to hear about investing? Just show of hands. Okay, most of us. Great. I don't want to bore you guys with a dry discussion about investing. So hopefully they'll be a little more interesting to you all. So I'm going to go through probably 5 trades that defined my career in many ways, and they happen to all be money-making trades. I don't want to tell you. I made a lot of bad trades in my career, and it would take a lot more time to talk about that. My lawyer told me that I should not go through those. I would have loved to, and I talked to some of you guys earlier about some of my boneheaded moves over the years, and I'm sure I'm going to make a lot more.
Fraud?
That's a good question. The jury will decide that one, not you. Sorry, I couldn't hear you. Well, the jury will decide it. I hope you're not on the jury. It requires an open mind and an examination of all facts. But I've started 2 billion-dollar drug companies.
Fraud isn't funny.
Sorry?
Fraud isn't funny. It's not a joke.
No, it's not funny at all. But I I didn't commit fraud, which is.
But you did.
Whoa. Do you know how the criminal justice system works? Let me finish. First, hold on. First you get accused, right? then it's determined whether or not the accusations are true or false. No, I didn't.
Why'd you get accused?
I'm not here to talk about my case, and I won't. But the point of the matter is that the jury is out, as they say on that. So, regardless, that'd be nice. We're not here to see you. The case is a fascinating case. The case involves an alleged misspending of $11 million. Anyone who's been through the case in great detail knows that this is a political prosecution. I was never alleged to have taken any money. I paid my investors a fortune. My investors send me Christmas cards. I don't know where the fraud is, nor do my lawyers. I'm not scared at all. That's why I'm here. But again, this is about investing. So anyway, I'm going to go through 5 or 6 of my big trades here that sort of formed my career. Again, here I am looking at this data. This is a pharmaceutical product by a company called Regeneron, and I'm studying this data. I'm 19 years old.
They fund STS now.
I still have zits, and I'm wondering, am I going to tell my boss whether I want to do this trade or not? Am I going to get fired, or is he going to do it, and am I going to be a hero? So this is a weight loss drug, and you see the 4 dose groups. This is a small phase 2 trial, and I looked at this, and I determined that this drug was not going to work. And in essence, this data was, I thought, not very compelling. The first thing that I noticed was that the dose groups were very low. Most drugs, this is not enough drug for almost any drug, even if it's very effective, to be useful. Microgram is 1,000th of a milligram, and most drugs are dosed in mgs per kg. This is a therapeutic protein. It's a recombinant.
Pharma greed kills.
Yes.
Pharma greed kills. 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 Pharma greed kills.
The presentation goes through why it doesn't.
Out. Walk out. Walk out. Walk out. Walk out. Walk out. Walk out.
Please do. Please do walk out. Have a great night. Sorry you couldn't be more open-minded. Well, the way bail works is every time. Thanks for coming. Nobody cares. Goodbye. Take an economics class while you're at it. All right, glad that's over with. But believe it or not, I actually agree with a lot of what these protesters have to say, which is remarkable if you think about it. But it's human nature to not want to hear information counter your theory. And investing, that's often one of the hardest things. You hear information, you're dead set on that stock, you have 10 million in that stock, you convince your boss to buy. There's some kids here that I met earlier that have convinced their bosses to buy 50 or 100 million of a stock. All of a sudden, somebody tells you that your theory is wrong. It's pretty hard to change your mind. Sometimes you have to, and we just saw that on display a little bit. So anyway, I look at this data, and I arrive at the conclusion that the company is a thanks for coming. Just let everyone sit down. If any of you guys are planning to walk out, or just let me know now so I can make fun of you and get it over with.
I think we've got a couple pairs of empty seats over in this area too, guys. So maybe 4 or so over there. An empty seat right here at the front.
So thanks for coming. And I just want to thank the Harvard Police for doing an amazing job. My new friend Joe here has been amazing. Alex Miller, who helped orchestrate a lot of this stuff. Obviously, the finance club and group. Thank you so much. This has been a very welcoming and heartwarming experience, and I hope I can share something useful. So anyway, Jim Cramer points at me and he says, it's your turn. You're going to do biotech stocks.
Martin Shkreli is a sexual predator!
How?
Martin Shkreli is a sexual predator!
How so?
Martin Shkreli is a sexual predator!
In what way? Don't leave. I want... In what way?
You for being in here!
Who have I preyed on? Because I'm really curious. I have the tame sex life. I have a girlfriend. we have sex once a week. It's consensual. Predator? I mean, you can call me other things, but I don't get that one. Out of nowhere. So I look at this drug, and it's a recombinant protein made in CHO cells. Big proteins don't enter the blood-brain barrier. The company's hypothesis was that this drug would somehow swim from your IV site to your brain and change some brain chemistry and result in this great weight loss. A lot of weight is controlled, in the appetite centers of the brain. So the company had this hypothesis. The only problem is that big proteins like this don't enter the brain.
Martin Shkreli is a racist! Martin Shkreli is a racist! Martin Shkreli is a racist!
How so?
Martin Shkreli is a racist!
In what way? In what way? Yes. That's okay.
What? Fuck you!
How am I racist? I'm friends with Lil Wayne. It's not possible. Maybe that was racist. Sorry. So, all right, back to business. So proteins don't cross the blood-brain barrier. They're too large. The tight junctions in the brain disallow, they're size exclusion barriers that disallow therapeutic proteins to enter the brain. Also, monoclonal antibodies don't enter the brain. So I always get frustrated now when I hear companies that have a monoclonal antibody that's going to enter the brain and hit a brain target and have this great therapeutic effect. But even as a 19-year-old, I tried to always familiarize myself with the basics. And you'd be surprised at how few people in healthcare investing don't know the basics. And I did this for a living, and we talked earlier about some hedge funds that do this. And it is really fascinating that, again, this stuff isn't hard, but it is a little esoteric, and it's easy to skip. But it's important to understand that all molecules have a weight, and that weight is important. So this is the final result of the clinical trial. I convinced Kramer to buy puts in this stock. The stock fell dramatically on this news. The result was a very modest weight loss. These patients are 250, 300 pounds, and you see about a 3-pound placebo-subtracted response, which isn't enough to, I think, merit a drug. I got the trade right. The stock fell dramatically, but I was somewhat wrong in the thesis. You can see that there is a very small, palpable, but small effect size. The p-value is the statistical strength of that size. There is a 3 or 4 pound reliable weight loss. Again, lucky for me, I didn't get fired that day. I was celebrated because the stock fell, and we made several $1 million in the trade. But at the same time, I hypothesized that there was no way this drug could even have any weight loss. So I learned a little bit that day. Here's the little news about the stock falling, plunging 60%. By the end of the day, it was down 70 or 80%. I figured this equation out at some point. It's an important one to know. The idea that goods have prices, goods have volume, and the product of the two is your revenue number. Some people try to maximize, some people try to maximize this, some people try to maximize this, but everyone is trying to maximize that. And for a long time in the 1990s, pharmaceuticals were about maximizing volume. All drugs had a similar price, in fact. And this was actually, believe it or not, a huge problem, because the only diseases that could be treated really were the ones with high volumes, things like cholesterol and asthma and whatnot. So if you had Gaucher's disease or Duchenne muscular dystrophy, and I know a lot of people with these illnesses, no drug company wanted to be involved because it was seen that the highest price you could charge for a drug was $1,000 or $2,000 a year, not too far from the price of toothpaste or other consumer products. So it was pretty difficult to rationalize developing and doing a massive undertaking and risk of developing a drug for a disease like that. And obviously if you're a patient with one of those diseases, and I'll introduce you to some of my friends who are these patients who rely on me. I don't think these protesters understand it, but they rely on me and I hope every day that the drugs I make will save their lives, that they're relying on me to live, and part of this equation implies that there'll be a high price to recoup that volume. There's 500 patients with a disease called pecan, which I invented the first drug for, and we'll describe that in detail in a minute. But this is, some people ask me, how could you be so evil? Where did you learn this from? Well, learn from the best. Warren Buffett, in fact, gloats over and over again about his See's Candy investment. If you know anything about Buffett, you know that See's Candy is one of those most prized investments. And Buffett explained to people that every time he raised price of See's Candy, he was shocked to see that demand didn't drop. And I remember the moment where I realized that, reading this story, that this is exactly what pharmaceuticals is all about. Demand will basically be constant no matter what the price is in most cases. So I realized this as a kid, and I looked at this stock called Biopharma, and this stock really put me on the map. I was working at, now left Jim Cramer's fund, I was working at a so-called Tiger Cup, and my job was to find stock picks, and I loved it, and I worked day and night to do it, and I found this little company called Biopharma. The stock was at $2 a share, they had 26 million shares outstanding, so they had about a 50 million market cap. They had a little bit of cash and a little bit of debt, but so the enterprise value was more or less the same as the market cap. So the company buys this drug called Vancomycin from Eli Lilly, sort of similar to what I did with Daraprim. They paid a bunch of cash to buy another company's drug that company didn't want anymore. Most of these big pharma companies, what I think, again, some of the protesters may not realize is, big drug companies like Eli Lilly and Merck, they don't want to own these crappy little drugs like Vancomycin or Daraprim. They want nothing more to get rid of them. And the reason for that is it's expensive to maintain these drugs. You have to make them, you have to register with the FDA, you have to do all of this work. And it's very painful to ensure that you're making this drug correctly and so forth. And it's not worth it for the tiny, this drug was selling 53 million. This was 10 times more than what Daraprim was selling when I bought Daraprim. So it's sort of painful to make these drugs. Some companies, one company I bought a drug from, they actually just stopped making the drug altogether. So if you think it's unethical to raise the price of a drug and make sure it's still affordable, it's really bad to just say, I'm throwing this away and I don't care about the 500 people or 1,000 people or a small amount of people that need my drug. I make drugs for millions of people, so screw it. I think that's, I'd much rather save those patients by charging them more, but at least they can get their damn medicine. So anyway, the company bought this drug, and what was remarkable is that the drug was selling $53 million. And in pharmaceuticals, there's almost no costs. So if you think about it, the stock was trading at 1 or 2 times earnings, depending on whether you look at the market cap and the enterprise value, which is really strange. Most of the opportunities like this don't last very long. So I studied this and I thought about it and I said, well, this is unbelievable. You can't buy a stock for 1 or 2 times earnings. We know the S&P trades at 15 times earnings or something like that. So I started buying the stock. I begged my boss to buy the stock. I didn't have the right to do that. So I kept buying it and it wasn't going anywhere. So I thought it would be a good idea to tell some of my friends to buy it too. And one fund I talked to said they already owned it. And then I met one friend in my career and I told him to buy it. And I was shocked because my boss would only buy 100 or 200,000 shares. My friend bought millions of shares. And I was pretty happy that he did, but I all of a sudden started asking myself whether I was working for my friend or my boss. So anyway, the stock price didn't respond, which was really frustrating because, the second you buy a stock, it should just go up, right? And obviously that's not how it works. So they reported earnings, and I was waiting, and they had sales of 8 million, which wasn't so great, but they gave guidance that they would have 60 million in sales. So even more than before. Then finally, they announced a quarter of 21 million, which is a run rate of 84 million in revenue. And then finally, the stock started to rise. It went from 250 to 11. I wouldn't normally be happy and sell, but I really wanted to make a splash, and I was studying the price of the medicine. And the price of the medicine was next to nothing. A pill cost about $10, $15. This is a life-saving medicine. So C. difficile-associated diarrhea is a nosocomial infection. You get in the hospital. So you go to the hospital for some other operation, and all of a sudden you end up with C. diff, and you die 4 days later. It's a pretty horrific life. It's literally deadly diarrhea. And at the end of the day, the value of the medicine was so much greater than what it was being priced at. And we're going to talk a lot about, are drugs too expensive? How do we fix them? I have a plan that I will be communicating personally to our president on lowering drug prices that I'm very sincere about. If anyone knows how to fix, if you think the system's broken, if anyone knows how to fix it, I think it's me. So in any respect, I ended up getting the company to raise the price of the drug. And demand didn't go down. In fact, demand went up, which was really strange. Again, you normally don't see that. In economics class, I think you learn something a little different. So anyway, the stock kept jumping up, and eventually we sold the stock, and it hit over $20. At that point, my billionaire friend was very happy. The fund I worked at was happy too, but I ended up starting a hedge fund shortly thereafter with my billionaire friend seeing the entire thing. So we'll continue on that, but that was an interesting situation where I faced some reluctance from the company in raising the price, but inevitably they really started raising the price, first with that 25% price increase. And I had to fax a list of similar drugs to the CEO. And I showed him a list of 20 infectious disease drugs and ranked them by price, and his price is at the bottom. And I said, do you really think your drug is this bad that it should be the cheapest on this list? And in many ways, you know, I think I was right, and you know, he certainly was judicious in how he raised the price. I took this out of the slide for the medical school students because it has nothing to do with medicine. There's a company called Thermo Fisher. It's a gigantic life sciences company, and we got approached by Barclays, the investment bank, to buy one of their businesses called basically their fume hood and furniture business. It's a pretty crappy business. Low margins, high capital costs. Why would you ever want this thing? Well, we were told that they were willing to give it away almost. So we got the deck, and there was a problem. The data room, you get these data rooms when you get into these processes. The data room had different data from the slide deck. So we were sitting here wondering, what are we really looking at here? This is strange. You know, normally the numbers would match up. We kept doing diligence, and we put in a term sheet for a $5 million deal. It was contingent on diligence. And they said, you can't do diligence on this company. I said, what do you mean? We said, we want to go to the manufacturing facility. It's in Mexico. They said, you can't do it. We want to close faster than that. And I said, we're about the fastest closers that you'll ever meet, but I got to go down there and kick the tires or something. And so somebody else is bidding, they said, and you know, you either gonna stand by your bid or not. And I said, I'm not bidding $5 million unless I can see this place exists. They sent us pictures in an attempt to satisfy me. So I passed, and somebody else bought it for only $1 million with a promise of 10 more millions of dollars. What ended up happening was strange. There was what they didn't tell us is that there was actually a drug cartel that took over the manufacturing facility, and they basically made it their headquarters. This is Thermo Fisher's in the S&P 500. It's a big, successful company. But the gangs actually would park in the manufacturing facility, and it was there. They owned it as far as they knew. So they've been in litigation since, but you know, it sort of taught me a little bit. You know, one of the good things about private equity, and I took this out of my slide again at my lawyer's request, but I wanted to talk about some of the mistakes I made. And my first hedge fund failed, partially due to my friend said you're a riskaholic, and I think that's it's obviously a funny play in words, but I do think that there's some truth to it. When you have a mouse and you have $100 million of buying power with one click, it's pretty intoxicating. And you need a lot of patience to be able to say, I'm going to be really sober and careful, not just during the day, but every day for the rest of your life. You're going to take that responsibility really carefully. And even Tom Brady throws an interception. But you know, you have to sit there and be unbelievably patient and careful. And something like that is really, I learned that it was meant for me. So my hedge fund failed, but it's a funny story. I ended up owing Lehman Brothers a bunch of money. They went bankrupt the next year. My friend said, hey, we just made $2 million. I owed them $2 million. Somebody bought that debt, and they said, I saw you in Business Week, so I bought the debt from Lehman Brothers, and I want my money. And I said, this is 8 years later. And so I ended up having to pay them anyway. And I had a few investors that lost money, and I went out of my own pocket to make sure that they were made whole. I think anytime you're given the responsibility to manage somebody's money, it's on you to make sure that they don't get hosed. Certainly, sometimes you can't help it, but nobody should have $100 million with their investors holding the bag. And I think that happens a lot in hedge funds. You know, a hedge fund will be down 10%, but because they're managing $2 billion and they have a 1% fee or 2% fee, they'll pocket $40 million in fees, even though they lost people money. To me, that's wrong, and I've always tried to avoid situations like that. So, in any event, enough about drug dealing. This is a trade I put on just a few years ago. And the company's called Celadon. Operative word is it was called Celadon. They're They're gone now, so easy come, easy go. It had about a 400 million market cap, and they had one drug. It was called Midocard. It's a gene therapy, so again, I don't know how many people here, anyone interested in medicine and science? All right, enough people. It's an AAV1 vector. That's a viral therapy, so the idea is that the virus will infect your cells and insert its so-called transgene, which is supposed to be therapeutic. This has not been a good strategy for drug development. It will have its day in time, but in general, gene therapy has been a pretty big disappointment. And so what was amazing, though, is this company had phase 2 data where they called the trial Cupid-1. They had an 80% reduction in mortality, which sounds pretty good. And you think to yourself, well, in phase 3, even if it's half of that, right, 40% reduction in mortality, it's amazing. The truth was a little bit different. So to make a long story short, I shorted the stock, and you can guess what happened. But the interesting part was sort of how I approached it logically. And when I invest, I try to be, at least as I've matured as an investor, and wasn't a riskaholic playing NASDAQ Nintendo, is what I call it. Clicking, you want to play League of Legends, that's a better place to exert your clicking energy on than the NASDAQ, Goldman Sachs. But again, I was young and mistakes are made, but you learn from them. And again, as long as I think you own them and you make things right in the end, I think that's sort of the philosophy I have. Very embarrassing, would have normally killed anybody's career, but I kept fighting and ended up doing just fine. So anyway, whenever there's dependent events, separate, independent events that require, in other words, the outcome is dependent on those events, you can actually multiply the probability of those events and arrive at a final probability. So if 3 things need to happen for something to work, I need to, event A, event B, and event C all need to happen, and they're all independent of each other. And there's a 10% chance that one happens, there's a 10% chance another happens, and there's a 50% chance, say, another happens. The probability that all of those will happen is 0.5%. And the crazy thing about, I guess, human nature is that it often becomes, that isn't as obvious. You look at people and say, oh, this has a chance to work. But then when you study it, say, there's actually no chance this works. And I've used that dynamic several times, and I'll give you 2 examples. So Celadon was one. And some people say, well, how do you do this? I only find 1 or 2 of these a year at best. In fact, I haven't found one since the second one I'll show you. But that could be for other reasons. This one was one I found. I found 2 in 2015. And so I made this trade. There were 3 events that sort of needed to happen. The first was that and again, not a lot of this is rocket science. So much of it is just very much logical. The drug has to go into the cell it's supposed to fix, right? That seems to make sense for it to work. The drug's got to get there, right? So we studied the data that was relevant to that, and the drug wasn't getting in there. For a drug to work, it's got to jam itself into the tissue that it needs to be in. And the reason that wasn't working is the AAV1 serotype transfects the liver way more than transfects the heart. We looked at the data and we realized there was almost no transfection. In other words, the gene persisting in the cell. And that was surprising. That alone should be enough to short the stock, right? There's no way that you could have, but how do you explain Cupid-1? How do they get 80% mortality difference? Well, that should scare you if you're a short seller. I mean, if you saw that, the stock would go from 20 to 200, and then you would really be able to bank a lot of money. So I had to explain that, and I looked at that, and what I realized was the patients in Cupid-1 who were in the placebo group, they were really, really sick. They had an ejection fraction of 15, which is very close to death. The patients in the drug arm had an ejection fraction of 30 or 40. They're actually relatively healthy for heart failure patients. The placebo patients were probably going to die in 6 months, drug or not. The patients in the drug group were probably going to die in about 2 years. So when the results came out, it didn't really matter if the drug worked or not. You could actually predict the outcome of the trial independent of the drug working or not. So I was able to sort of explain that Cupid-1 succeeded in spite of itself. It wasn't really a test of the drug's efficacy. It was a test of whether or not really sick people die faster than not so sick people, which is relatively obvious. The final thing was that the mechanism had to make sense. So even if the drug gets in the cell, even if the phase 2 study was a fluke, what the drug does exactly has to make sense. And in this case, we felt that it did. So I won't go through that science too much, but this is a calcium channel, calcium pump in essence, that allows the sarcomere to contract. And we felt that was not really that useful. So the stock fell a lot. I don't have any investors, so this was all just my own money. have any hedge fund limited partners or anything. So I made the trade, and for your average hedge fund, this is like I guess for me, it was my own personal hedge fund. It was a fantastic trade. Not long later, this thing happened, and so one of my hedge fund partners suggested that I look into this company, and we both arrived at the conclusion that this was a good short. So I wrote this 44-page paper. A long time ago, one of my friends said the best way to battle your riskaholic nature is to actually write down why you're doing your investment. When you do that, you get it right. When you don't do that, you're playing NASDAQ Nintendo, you're just losing and throwing away money. So over years, it took a lot of weeding. I decided to say, I'm going to write down whenever I'm going to make a big bet, I'm going to write it down. So you can actually read it up there, and I won't summarize it too much, but this is a company that tried to make a liver that lived outside your body. It was for people who have liver failure. You would route your blood into this machine, it would purify it and send it back. This is how dialysis works. In fact, there's a heart lung machine as well for people who are in coronary artery bypass graft surgery. So this isn't a totally crazy idea. It's a little crazy, but it's not totally crazy. They put liver cells in the box. I call it the box. And your blood goes to the box. You have these liver cells that should be acting like your own liver, and sends your blood back, hopefully detoxified. All right, not so bad. There was a couple of big problems, and I'll show you the data. The data didn't make any sense, and this was the biggest flaw. But the other flaw, I wasn't sure just from that. I needed to be really sure. If I'm going to put $20 million up to make $20 million, I better be right, because I don't want to lose that money. That's a huge bet for me. So in any event, the fact that this thing was designed, I actually think a shoebox would have been a better device. This thing was really poorly designed. You can read the 44 pages to see why, but I really felt like I had to prove it to myself if I was going to bet a lot. So these are Kaplan-Meier curves. These are survival curves in essence, and I want you to look at the left one first. And what you see should alarm you. Basically, this is a survival curve, and you can see that the liver assist device, ELAD, patients seemed to be doing better than the control patients. They were surviving longer. In fact, by 60 or 80 days, most of the patients in the control group are dead, which shows you just how much of a need there is for a true liver replacement. This isn't the company that's going to bring us a liver replacement, but you might think oh, this guy's short selling all the time. Well, I have a lot of long investments, and learning about this has now primed me for if I ever meet a liver assist device company, I know exactly what to do. And I even thought about starting my own because the need is so great. And I learned all the science and technology, and I figure I can do it better than they can. So in any event, you can see that the p-value is 0.27, which I know there's a statistics professor here. This is not a robust p-value. The chance that this effect due to chance is 27%. I don't trust p-value. Any p-value, there it is. I don't trust any p-value. I don't trust any p-value below 0.05. Near 0.05. It has to be 0.01 or less. So what the company did is, okay, so this is a failed trial. You see the Kaplan-Meier curves intersect. It makes no sense that these patients all of a sudden get a lot better at day 30 and there's a true separation. In fact, it looks like the control group is better for 30 days. You only take this device for the first 7 days. This is a mess. I mean, there's no way this thing works, right? So what they decide to do is go fishing. And they decide to look at only the patients who have non-alcoholic acute hepatitis. So they say that, you know what, if you just look at these patients, they did a lot better. There's early separation, and you've got some, subgroup. But the problem is there is no rational reason to believe that these patients, the non-alcoholics, would do any better than the alcoholics. And we dug really deep into these alcoholic patients. Half of them were alcoholics. So it really made no sense. They had a prior history of alcoholism. They weren't alcoholic for that liver failure, but at least from the morphological perspective of, is the liver different from the other subgroup? It didn't really make any sense. The p-value still isn't significant. So this is truly a mess. And we get to this, it's something you learn in statistics called Bonferroni correction. And it's pretty technical, but in essence, it means that you can't get 100 bites at the apple. You can't look and look and look and look for an effect size. And if you keep doing that infinitely, you will see an effect size. If you change the primary endpoint of the Super Bowl is the number of points scored at the end. But if you wanted to make the primary endpoint the number of points scored in the first quarter, I don't know, I think the Falcons would have won the Super Bowl. But you can't just change the rules after the fact. And that's what the company tried to do. If you change the rules after the fact, you better have a good reason to do so. For instance, you could say, well, there were 10 patients that, were put in the wrong arm. They should get the wrong device. Okay, it kind of makes sense to say, all right, let me see who actually got the real stuff and exclude the ones that were maybe accidentally randomized to the wrong device. But that's not what happened here. The company was looking for a reason to continue on. This is very common in business where a CEO wants to have his $300,000, $400,000, $600,000 salary, and there's no way he can look at this and say, yeah, let's give up. I'm fired. You know, nobody does that. I'd rather spend shareholders' money. Any sucker that's born today who believes this bullshit, I want to spend that guy's money, and I'm getting my salary, I'm getting my bonus, I'm getting my perks. I get to tell people I'm a CEO.
Yeah.
I don't think you should ever want to be that person. So anyway, the trade comes out. I'm waiting to it's Friday at 4 o'clock. Options expire this Friday at 4 o'clock. They're worthless on Monday. So we're pretty pissed off. The company we calculated has been holding the data for days and days and days and days. We know that they failed the trial. And it didn't matter though, because if they don't release it by the time our options expire, our options are out. So we were gonna lose probably $5 million, but still hold a good chunk of our bet. 4:01 p.m., the stock gets halted. And I just start screaming. And it was, we knew that the result would be bad, but we were so happy that they would announce that the trial would come out before options expiry. And the rules are very esoteric. I think we challenged every single investment bank that day as to what the rules are on how options expire on Friday at 4 o'clock and how much time you have to exercise them after the close. Unbelievably, so the hazard ratio is 1, so the drug and the device actually, the dummy device actually slightly outperformed their brilliantly designed shoebox, and the p-value was 0.9, which is basically, you know, an equal randomness. Unbelievably, they had the nerve to say that the patients who had a different prognostic factor did better than the other patients. So they're doing the same shtick over again and saying that, well, if you just look over here, this half did really well. The dissembling part of that is that the other half did worse than the mean. So you can always have a group that does better than the mean and a group that does worse than the mean. It's very disingenuous to say, let me just focus on the one that looks good for me. So these are the sort of tricks I think drug companies try to play. And again, it's mostly in hopes of perpetuating a salary or a company and not wanting to change your mind about something. Maybe, like I said, the theme about the protesters. So you know, those are a few of my investments. I've mostly talked about them, but I'm going to start talking about drug pricing, and I hope somebody's interested in this. And I think a lot of people here, sort of the anti-processors, if you will, have also maybe made up your minds on the situation. And if you get to know me, you'll learn that I never make up my mind on anything. I always want to be open-minded. I always want to absorb information and be as sort of even and open-minded as possible. So how do we price drugs? Like I mentioned, before 1990, there was no such thing as a billion-dollar drug. The biggest drug in the world was Zantac, and it barely cleared $1 billion. This is the antacid that's available OTC. But finally, around 1990 to 2000, there was this big explosion. There are drugs like Plavix, Lipitor, Zyprexa, Prozac, and endless more, Risperdal, et cetera, Zoloft, that sold billions of dollars. Claritin was a big one. And this came from just more sophisticated medicinal chemistry and more sophisticated biology. And there was a renaissance. But as you may notice, all of these drugs are for big mass market conditions. There's one company here in Cambridge, Kendall Square. I actually rented their office when they moved out, when I built Retrofin's Cambridge office, called Genzyme. Genzyme developed a drug for Gaucher disease, which is a horrific, deadly illness that is rapidly fatal. It's a lysosomal storage disorder where one enzyme is malformed. That's a common theme in genetic diseases. I'll talk about my disease, PCAN, where that enzyme is malformed. So anyway, in Gaucher disease, there's only a few thousand people with this illness in the world. And Genzyme had the idea that they would charge $350,000 for the drug. Nobody complained. If you're that dying patient, you're thrilled. It's the best day of your life. If you're an insurer, you say, what's Gaucher disease? Oh, it's a fatal disease. Just pay for it. The patient never pays a dime. It's the insurance company doesn't have a heart to charge them a copay. What are you going to do? Ask for a $1,000 copay? It's not fair. So that's another thing that people sort of don't understand. Drugs like Cerezyme, which is the name of this drug, and drugs like Daraprim are covered by insurance. Nobody gets a bill for $750. Nobody is asking you to pony up your life savings, and we'll see that more clearly in a minute. So what was amazing about the Genzyme story is that it ushered in this new world. There's another Cambridge company, a lot of these are Cambridge companies, called Biogen that developed the first drug for MS called interferon beta. And Biogen proved to Pfizer, Merck, Johnson & Johnson that that old price times volume equals sales calculation, that companies like Pfizer and Merck that would laugh at multiple sclerosis and laugh at these orphan diseases. I'll never forget the day I met a senior executive at J&J who literally said, when I told him that I was a young orphan drug company, he said, "Cry me a river. Orphan drugs are like when a kid falls down a well. The whole town gets there and tries to save the kid, but I'm here to develop drugs for diabetic nephropathy and Alzheimer's and serious illnesses." Well, if it was your kid, it'd be serious to you too. And these are illnesses. You might know somebody with MS. You might know somebody. I know 3 people who died of multiple myeloma, CML, and other diseases. And the only way to make these diseases worth treating, from a financial perspective, from an ethical perspective, they're always worth treating. But unless you can charge a lot per patient, there just aren't that many of these patients out there that have these illnesses. There's 1 million people with rheumatoid arthritis, but there's only 5,000 people with CML. And even for rheumatoid arthritis, 1 million was just on the border of what a drug company would be interested in 20, 30 years ago. Today, everything's different. So how do we price drugs? What's a good idea? I mean, I like this idea, which is that price should be equivalent to value. That the value of something and its price should approximate each other. And that we shouldn't take into consideration things like, do we like the CEO? Or what was the price yesterday before the price was corrected for its value? Which, again, I think should be irrelevant. If the price yesterday of a good restore that price to a normal value, the way I look at it is that everyone was getting a free ride before. Not that this is now price gouging. It's price gouging if it's above its fair value. If you're charging a lot for a good, and it's an unfair price, that it's not providing its value, then I think there's something wrong with that. And in general, you will not succeed. So a good example is a heart attack, which costs, say, $100,000 to treat. I mean, it's an arbitrary number, I'm not totally sure. And if you had a drug that saved 10% of heart attacks, it would be reasonable to charge $10,000. We have a lot of shenanigans going on here. So I think there's a lot of pros to this. It's utilitarian. It encourages a fair market. It rewards incentives. It provides a lot of great things. Unbelievably, patients, physicians, and payers agree with this. I have never gotten a call from an insurance company saying your drug prices are too high. And we'll talk about that in a minute too. The cons are that if there are changes that correct the value of something, they can often be unpopular. We all good?
So we're running a little short on time, so we want to jump into the Q&A as quickly as possible, make sure people have a chance to get the questions answered.
Okay. Let me just see here. I'm very early on. I'll go really fast. So this is the drug that we use the Daraprim profits to make a new Daraprim. And it works a lot better. It's safe. Dr. Welsh sat next to me at Turing, and we hope this drug replaces Daraprim and it's a much safer, better medicine. There are a lot of flaws to single payer. I talk a lot about this stuff. I did not do this. Over the last 60 years, we want to spend more on healthcare. It's not an accident. It's not a recent phenomenon. It's not my fault. Physicians and hospitals are the largest cost to our healthcare system, not drugs. We get a lot of the flack for it. But at medical school, I asked those guys to take a pay cut. They didn't love that. The present value of being a doctor is pretty high. It's a $2 million trade. You spend $50,000 a year for 4 years, and you make an extra $100,000 a year for life. That's a good deal. So only 600 people pay for Daraprim. Their insurance covers it, and the copay is $20. 1,400 people get it for free. I wish no one got it for free, but the rules are that they get it for free. And again, if anybody can't get the drug, I just met my second patient since I raised the price of Daraprim that couldn't get it. The second guy. And both times there were patients that they might have been undocumented and they didn't want to necessarily go through all the hoops to get the medicine, and we needed to sort of improvise, if you will, to get them the drug. Daraprim happens to have a different patient population than most, so it's partially why we have to give away so much medicine. And we also have to make sure that we make some money on the 600 patients. So the net price for one, I've lost this quickly, but for one course of Daraprim, it is roughly $20,000. And it's curative. You only have to take it for 40 days. Every other medicine, you're taking for life. So the fact that you take 40 days of Daraprim it ends up making it a really cheap drug and an efficient drug. So and nobody doesn't get the drug. So the idea that I'm a murderer is a little strange. So I'm the best, and this is why. I saved this kid's life. I read the news story and basically just jumped into action to make sure that through back couriers in rural Venezuela, this kid could get the medicine. And if you want to read the story, Karina did a great job documenting our odyssey to save one guy's life. This is my disease. I say that not because I have it, but because I know almost everyone that does. PCAN is a disease that I studied this very carefully, and I realized that if I could replace, PANC is malformed in PCAN, if I could replace phosphopentotheniate, I could save these kids' lives. I did that. I won 2 U.S. patents for it. This is how the drug works. Dr. Vino and Mr. Biestek aren't here, so I will say that I did 95% of this work. My friend Kevin here will testify to that. He was there too. The drug's in phase 3. We'll see if it's a real McCoy. It might be, it might not be. These kids' lives depend on it. Ty, Tanner, and Lane. The oldest kid is very close to death. This is a disease that nobody cares about because 500 people have it. You can't sell a medicine for 500 people. It's very hard. You have to make that drug very expensive. I talked to Laura quite a lot. We fought with the FDA to get early access to it. We lost. We had to wait an extra 6 months, and we hope that the drug works. We'll see. Talk about some music, different things like that. Do we want to go to Q&A? Okay. I'm not like a greedy, crazy person. I love my cat. I've never taken a legal drug, including marijuana cigarettes, which I know many of you have. I'm a nerd at heart. So this idea that I'm this flamboyant, playboy, I guess sexual predator as well. I don't know where people get that. I don't even leave my house most of the time. I'm kind of a hermit. These are the diseases I'm interested in treating. These are some of the great advances I'm looking forward to in the next sort of 5, 10 years, 15 years that I think will happen. There's some really cool stories about medicine here. This is a gene malformation. This is an even crazier one where you can't feel pain, and these are inspiration for new potential therapies. I think CRISPR is bullshit. I think weed is bullshit from a pharmaceutical perspective. I don't think weed cures cancer. Pretty sure I'd bet anything on that. I have a solution for high drug prices. I think Trump should start a drug company. I think that basically if we're so outraged by these big drug price spikes, the government can step in and guarantee, my Republican friends will hate this, but they can guarantee that generic drugs will be supplied without price increases. We do have a problem with generic drugs. I've taken advantage of the problem. Whether you love me or hate me for that is up to you. But I always make sure that the money goes to the right place and that the patients can always get the drug. But there is a solution to this. I'd be proud to help implement this since it's such an important need and there's so much outcry. Let's just do it. And I think that a state-owned enterprise has worked in China. It's worked in other countries. It's not a bad thing for the government to run a company. It just has to be done right. We have Fannie Mae, we have Freddie Mac. There are ways to have a private-public partnership. It's not easy, but it's possible. The government should also run an insurer. They do something like that. Insurance companies profit from inflation. This is an income statement of an average insurer. You can see their income in 2021. If there's 5% inflation, they make $1.1 billion. If there's 1% inflation, they make $900 million. Insurers love price increases. I've never been called up and asked, Martin, why'd you raise the price of this drug? I'm pretty sure they love it because they make more money. And if we all agree that's a bad thing, and I'm pretty sure it's a bad thing, if the fox is guarding the hen house, we should have someone who's independent. There used to be, this is a member berry, people, member Blue Cross Blue Shield. This Blue Cross Blue Shield used to be that. In 1994, they sold out, and there's no more Blue Cross Blue Shield. The name exists, but now it's just for for-profit insurers, so basically the fox and the hen house met in 1994, and ever since then there's been runaway healthcare costs. I don't think that's an accident, and I think very, very few people know this. So with respect to politics, I don't know if these protesters know this stuff. I'm pro-affirmative action, I'm pro-choice, I'm pro-feminist. Gay investors built all of my companies, believe it or not. I'm I'm pro-Planned Parenthood. I've given so much money to Democrats. I don't know if this makes me a Republican, but after the last election, I think I am. But I just think, a lot of people don't appreciate this. So I have a couple of slides left. This is the True Love, Lauren Duca, and that's it. I'll skip these 2 slides. Thank you so much.
What? Yeah, Vincenzo is a big guy. What? What?
All right, thanks. That was great. Sorry for rushing you along there at the end.
Yeah.
But you get mic'd up.
Yeah.
He pulled the fire alarm. I hope that was okay.
We encouraged him to do it.
I just want to make sure it worked.
Test. Okay, good.
All right, cool. So we'll just jump right in. This will be sort of a rapid fire Q&A since we don't have much time left. Can you tell us more about how your investment philosophy has changed after your Lehman Brothers put fell through?
Yeah, I mean, I think I have a bit of a perverse view on this, and I'm not here to make friends. I think if you can take advantage of a stupid bank, you should. In fact, a lot of Wall Street's built on this. The banks that wrote the CDS and other risk for some of the huge trades in the mortgage crisis, those banks were dumb. They put their clients' money on the line, and they shouldn't have. And the hedge funds were really smart in the way they structured those trades to take advantage of the banks. If Deutsche Bank wants to, I have a big trade I want to put on regarding the spread between equities and debt. If they want to put $2 billion in this trade on, and I only have to put up $50 million, and they want to take that risk, let them take it. That's up to them. I felt horrible for what happened to Lehman, but over time I paid them back, and I wanted to take a lot less risk. I've been a lot more careful, and I also realized what I was good at. I'm not a great trader. I'm a terrible trader. I'm a good investor, and I'm a great entrepreneur. So I realized painfully that I should stop banging my head against the wall and start going with the flow instead of against the flow. I always wanted to be a great trader. It's so romantic. You're clicking buttons and all the money's popping out. It's exciting, but I'm bad at it. And sometimes, you have to, somebody's got to tell Michael Jordan he shouldn't be swinging a baseball bat or something like that. But, I'm a great entrepreneur. I put my record up against anybody, but, I learned that you should not push against the closed door.
Gotcha. Okay, so now talking about drug pricing again. The question is, why did you raise Daraprim prices by 5,000%? And I guess I would add on to that, how do you choose what the appropriate high price is for a drug if you're intending to price more aggressively?
Yeah, I mean, so the reason for why is there's a few reasons for that. I mean, the first is that obviously to increase profit for the shareholders. I felt the price was untenable. At that price, one course of Daraprim is 40 pills. So the same price for one curative treatment for a life-ending illness is the same price as an Xbox. To me, that doesn't make sense. We know that things that are really valuable should be priced at least somewhat near their value. And at $20,000, Daraprim is still unbelievably underpriced. There's, again, that weird gross to net problem where 2/3 of the drug is given away. $250 a pill, you need 40 pills, that isn't a lot of money. And if you look at the efficiency of cost, there are drugs that, this is Soliris, meet Soliris, it's $400,000 a year, you take it for the rest of your life. You're going to pay this company $9 million over the course of taking this drug. You're not going to pay it, your insurance will pay it, but it's $9 million for having a rare disease drug. So my $20,000 didn't seem so bad to me. It was an election year. I'd done this before with other drugs without a hitch. It happened to be an election year, and all went haywire. But again, I made sure that I would take the profits and not stuff them in my pocket, but and live a different life than I'm used to. I was living the same modest and charitable life, and I took the profits and I said, I'm going to invest in a better Daraprim. Daraprim sucks. It's my only product, and it sucks. And I want a drug that is worth a modern medicine. That drug was invented 70 years ago. People get angry if their iPhone is a year old. Imagine the life-saving drug you need to survive is 70 years old. It was made before people even knew anything about DNA. This drug only kills the toxoplasmosis. It does not kill the human. Daraprim kills both. Daraprim's a poison. If you keep taking it, you'll die. But you hope that it kills the bug faster than it kills you. And that's not a great medicine. And nobody wanted to make this thing. There was no interest in making a better Daraprim until I came along. So I sort of felt I would ask this community of toxo patients, to reimburse this medicine more, and at the same time, it would give them back a much better drug.
Gotcha. And then jumping over to your experience in finance, how did you get funding to start a hedge fund at 24 years old?
It was the biopharma trade. So, you beg and beg and beg, and you ask a hedge fund manager if you can work for them, and some of you have figured that out, which is great. Tell them you went to Harvard, and that helps. I played guitar for Jim Cramer to win his fancy. And he asked me if I played. He said, "What do you do? What's your deal?" I said, "I play guitar." And he said, "Really? So if you brought your guitar in for the second interview, you could play me songs?" I said, "I'll play any song." He said, "All right, we'll see." I bring the guitar, I play him, his wedding songs, and he's happy he hired me. You never know how you get your break, but I worked hard. I got a reputation for working really hard, too hard sometimes. And I suggested that one trade that worked out really well, and I was smart enough to tell some other people. People inside my firm didn't appreciate it as much as I wanted them to, so I told a few other people about it. And the reputation of making 10 times your money in a few months is something that people will remember. And even though I didn't make any money that year, I made $80,000 that year. Forever people said, "This is the guy that picked the one stock that went up 10x this year." And from then on out, people were willing to give me small amounts of money. I started Retrophin with $2 million. I started my first hedge fund with $2 million. After I failed at my first hedge fund, investors were a little bit more cautious. And then I started a second hedge fund even less.
I was also curious about that. How did you get funding after the first fund?
I was very close friends with the investor, and we practiced together, and we made a bunch of money in his personal account. He was actually my college friend. We decided to roll that boulder up the hill again. And when we started a drug company, we did that with $2 million. So it became a $1 billion drug company. I owned 20% of it. I then started insuring. We raised $100 million without lifting a finger. And so it got easier as we proved our success. I owned 50% of Turing. So you do the math. I think Turing's worth about $1 billion. So it was very lucrative, but it was a lot of pain and a lot of kind of modest starts between then and now.
Gotcha. So this question, it's sort of lengthy, but I guess the essence of it is you mentioned that the government should step in and essentially guarantee reasonable pricing for critical drugs. How do you see that dynamic playing out in terms of, doesn't that create an incentive for drug companies to price even more aggressively if the government is backing it? And this question specifically asks about nationalizing the drug research process.
Yeah, I don't think that's a good idea, but I think that when a drug has gone off patent, a firm should not expect any more earnings from that drug, and nobody does. It's just that on occasion, if there's 3 suppliers for one generic drug, and one has a production problem, and the other one merges with another company and doesn't want to make anymore, you got a monopoly again. And that really shouldn't happen. That's not the spirit of intellectual property. And guys like me will sit there and wait for something like that to happen and take advantage of it. Again, I'd rather do it ethically. I think most of my rivals don't know the difference between a nitrogen atom and an oxygen atom. At least I pretend I'm doing something. The average guy is just sort of, look, we're trying to make money. That's not my goal. I hope I've made that somewhat clear. I had to rush through it. But, so I think if the average drug company like Pfizer doesn't expect any earnings after their patent expires. And it's this sort of weird little, call it vulture capitalists, like what a lot of people think I did with Daraprim, that take advantage of that situation. So if the government's just providing these old drugs as a utility forevermore at a low price, I think that's a good thing. Nobody's getting hurt. Maybe a couple guys like me will have to go do something else with their money, but I think creative destruction is a great way to fix laws. Someone is abusing some kind of loophole. That's a great way to learn there's a loophole and close it. There's a carried interest loophole. Hedge fund managers become billionaires off the carried interest loophole. It's going to close if it hasn't closed already. And by having laws that get tested, the laws get better over time, and we evolve as a society. It's one of the reasons our country's so great.
Yeah, so unfortunately, since the event got started late because of the disruptions at the beginning, we're going to have to cut things short here, everyone. So thank you for coming up.
That's really cool. Yeah, I really did that. You prepared really well.
Are you ending the stream?
Huh?
Are you ending the stream?
Let's see what outside. There might be some interesting content.
Yeah.
Mac.
So what do you think about the whole like drug pricing thing?
What do I think? What do you mean?
I mean, do you think he's right?
Wait, do I think he's right?
Until I really
Oh, this is mine. Thank you.
Sam, can you hold it for a second?
This? Yeah.
Yeah.
I'm gonna see. Where's my umbrella? Wait. Do I do it?
Can we go find him? Probably not. Where's Matt?
Yeah.
Yeah, what's up? The problem is, I feel kind of weird. If he was our age, we'd be best friends with him.
Yeah, I mean, Josh, that I can say it again.
No, I hope not.
Come.
Gosh, is this serious?
Oh, you want?
Oh yeah, thanks, man.
Man, dude, the Palantir
Wait, I want
charger.
this.
Wait,
Okay, you're just cleaning up after me.
Hold up, dude. This guy.
Yo, if Mac's right and I'm like him in 10 years, I'm gonna need you to clean up after me.
Dude, this was interesting, man.
Yeah.
So.
On point, Abdul. Yeah. Yeah, but he's got his lawyers prepped him well. He's like good at presenting. He's pretty charismatic too. What is this? Oh, yo, dude, have you uploaded the slide deck?
Wait, can you add?
Wait, can we like download it? Well, wait, hold on. Just like take a video.
We're in the back room here.
No. This is just 3 different videos.
Oh, this is what goes on when you record
Yeah,
it. Like this
yeah.
looks like the online website.
This is the online recording. Yeah. This is the slide deck.
Did they record it?
They were live streaming it, I think.
Really?
Alright.
Because they said you couldn't record.
Yeah,
Oh, yo, wait, they have the slide deck. It's right there.
publish?
Do you work for MTS?
No.
Have a good night. You know better.
Fair enough.
Thanks for not getting on us.
We appreciate it. Yeah. All right, fair enough.
Thank you all.
Now back out to the Harvard
Are we
snow.
talking about the like stock trading on Yahoo? No, he went to Hunter.
Hey Jared.
Oh, right.
Wait, where did we lose Mac?
No, that's right here. What's your left? No. Oh, Matt.
Yeah,
Or no?
Mac. All right, so long everyone.